is Tori Devine, and I am the Director of Clinical Supervision and one of the clinicians at the Massachusetts Safe Home.
And I'm Christina. My role at the Residential Safe Home in Massachusetts is the Group Therapies Director as well as Program Clinician. So thank you for being here today. We are going to talk to you a little bit more in depth about the clinical role that we both play in the residential program. And Tori, why don't you take it away?
Sure. So the women that are coming to our program have these extensive, complex trauma histories that we want to help them work through while they're in our program.
So we're going to talk to you a little bit about grounding techniques, which is a form of mindfulness. So when somebody is recovering from trauma, oftentimes they might experience some sort of dissociation. They are having a hard time just dealing with their emotions, and anxiety is a big factor in this, in trying to get to a relaxed state of mind. So for people who don't experience trauma or complex trauma, such as the women in our program experience, anybody can use grounding techniques. So if you are on a bus, if you are in a social event and you're having anxiety, you can actually practice these grounding techniques and nobody's going to know about it. So I'll start you off. The first one is, well, really you're focusing on your senses. So the first one that you want to do is your sight. So you can say 5 things that I can see. And you really want to hone in on what those details are going to be. So right now I can see this shiny object. It's pink. I can also see a mask over there. I can see Tori's blue eyeshadow. I can see the mirror over there reflecting the light. So I'm focusing on those moments to bring my attention and really being mindful.
The next sense we like to focus on is feeling. So we would focus on feeling 4 different things. So I have this bracelet on, it's rubbery, I can feel that. I can feel this table that's in front of me, it's nice and smooth. I feel my shirt, it's very, very soft. And I can feel this marker, and I can kind of feel like the plastic feel to it.
The next one you'd want to do is hear. So you have to silence yourself for a couple seconds. I can hear the cars driving outside. I can hear the fan. And I can manipulate. I can hear myself tapping. That's also a really good grounding technique.
And the next sense we would focus on is smell. And sometimes that could be a little bit trickier. But again, you can utilize things that are near you. So in my bag, I have some lotion. I could smell that. It smells good.
What if you don't have a bag or anything on you?
I can smell my hair. I washed my hair today. I can smell the shampoo in that.
Yeah.
I can smell the air right now. It's like a nice clean smell.
And then the last one you want to focus on, which can be the hardest, would be taste. So oftentimes this also needs to be manipulated. So a piece of candy, a piece of gum. Sometimes, you might not be able to have something that you can actually eat at that moment. But if it's helpful that you can kind of look around to see, how would this taste? I see that cupcake over there. I'm not eating it, but I know it would be really sweet. So those are some examples of what grounding techniques that not only our women in our residential program do, but anybody can do them to help with that anxiety.
So what do grounding techniques do for us? It's a practice of mindfulness, so it can really help us come back to reality, really to exactly what it says, ground us, really kind of takes us away from any anxious feelings we might be having or any anxious focuses, and really allows for us to use our environment for our benefit.
So I hope that you gain some insight on some things that we might do with our women in our program. And hopefully this is tools that you can pick up for yourself and share with others if they're dealing with similar things. So thank you so much for joining us and listening to what we have to share today.